day, as usual, is hybrid, which of course makes Anna and my life much shorter because it's much more stressful. So forgive us if we have any technical hitches. We managed to get people online from Canada, France and Spain yesterday, and had more difficulty getting people from the local area online, ironically. But hopefully today will go more simply. We shall see. But please bear with us if we have technological problems. So when you're online and joining us, please can you make sure that your camera is off and that your microphone is off. We did have an interesting moment yesterday where our presenters from Spain did not realize the time difference. So we had them joining another presentation, and it was quite a moment when they were on the screen as well as the presenters. Everybody in here, please, mobile phones on silent. Once again, I trust mine is. So when we have the presentations, assuming there is time, we will have questions to the presenters at the end of the presentations. So for people in the room, if you make yourselves known to me, and for people online, please, if you have a question, if you put it in the chat box, we will endeavour to get as many questions as we can to the presenters. But we will, so far, been allowed to share the presenters' contact details with everyone. So if there are things you wish to discuss with them, hopefully you'll be able to do it after the conference, either in person or online. If you are asking a question, it'd be great if you could tell us who you are before you ask the question. The way the day runs is this is the main conference room. All the plenary sessions will be in here. And then when we have the breakout sessions, today there's only one extra breakout room, which is over in the Montgomery Pavilion on the ground floor. Online, you will click on Teams Room 1 for the breakout sessions. And then once the breakout session finishes, we all gather back here, or you click back on the main conference link. As you see, there is, for those of you who are here, there's a huge array of posters. I think there are 33 entries into the posters display. Please take your time to look at them and score them. It's important we get as many people as possible scoring them, and those online will have a chance to score the posters later this week. For those in the room, in case you hadn't noticed, there's posters on the back of the boards as well as on the front of the board, so please walk around the whole lot. We have in the room simultaneous translation, so if we could just try that. If anybody's going to need simultaneous translation, if you grab a set of headphones and plug them in, the translator will just say good morning, and so everybody can make sure they can hear if they need them. Great. Okay, if you're having problems with that at any point, just ask one of us to help out. So I think that ends the housekeeping bits for the day. If anybody has any problems, grab Nia, who's at the door, Anna or me, and not so much me, but one of them will be able to help out. For my opening remarks, I will keep them brief because you've not come here to listen to a sheep farmer from West Wales. You've come here to listen to people doing interesting things in developing services for rural communities. I have to say I'm feeling a bit hurt today to have been upstaged by a mini robot called Pepper, who's in the room, who seems to be getting a lot more attention than me. And it was even suggested Pepper might be a better chair of the meeting than me, which was quite insulting. But if she's a quick learner, I said she probably will be. So yesterday we did have presentations about artificial intelligence and technological solutions. And then we had presentations about examples of those that are happening in rural areas. We had talks on how the management and organisation of rural services has undergone dramatic change due to COVID and other things, and how there's a feeling that the culture of management of services needs to change in order to allow the incredibly fast-paced changes that happened during COVID to continue to be allowed to happen without them getting stuck in a bureaucratic puddle that they occasionally do. We also heard from the Minister, who told us of many initiatives she's putting in force for rural areas, which will hopefully help to either drive change or facilitate change. Today, we're looking more at the education of an appropriate workforce for rural communities and how things are changing so that we can educate our future workforce appropriately. And we've got some breakout sessions on nutrition and health as well. Yesterday's conference ended with the link between Coleg Ceredigion and Canada, Alberta in Canada, about training young higher education students in rural care, both health and social, and they're setting up the Rural Care Academy, and they've just arrived as well, which is brilliant timing. Morning, Coleg Ceredigion. So today we continue the theme of education, and I won't delay you much longer. I will just try to keep waffling while our students get to their seats. Morning, everybody. We have a series of plenary presentations today, starting with Maria, who is the chair of the Mid Wales Joint Committee. The Mid Wales Joint Committee was set up in 2015, I think it was now, a long time ago, when it was realised that in order to develop and provide rural services for the area of Mid Wales, some mechanism for integrating the work of the health boards and social care across Mid Wales was needed that wasn't there at the time. And I have to say that there's been massive progression in the integration and collaboration between health and social care, which was given a good kick start by the COVID crisis. Similarly, we were always trying to introduce technological solutions to access issues for the people in rural and sparsely populated areas. Once again, the pandemic has given that a kickstart. We were finding it harder to progress technological solutions, and once the pandemic arrived, that was given massive impetus. So we will hear later about how the triple whammy that's around at the moment of COVID, Brexit, and climate change are likely to affect us. But from my perspective, COVID, though a dreadful time for all of us, has helped with certain innovations. So I think everybody has arrived now, and I shall hand over the baton to Maria, who is the chair of the Mid Wales Joint Committee. Thank you.
Bore da, croeso, and good morning, everybody. My name is Maria Battle, and I'm the chair of Cyhadledd University Health Board, and it's a great honour to open the second day of the Rural Health and Social Care Conference. I hope you really enjoyed the first day. I've been reflecting on what to share with you this morning, and I've decided to speak from my heart. I think you'd all agree that we are facing an unprecedented, challenging time in health and social care. Some of us would say it's worse than March 2020, when we faced the unknown of the pandemic. We know what the challenges are now. We have a very tired workforce across health and social care who gave everything during those years of the pandemic. We don't have enough workforce in health and social care in West Wales, despite having the most beautiful place in the UK to live. We have thousands and thousands of people who are waiting for the health and social care that they need and that they deserve. And we've got 1,600 people across Wales who are in hospital beds waiting for social care, and they don't need to be there. And all of this is a heavy burden on our staff. Some who feel, and perhaps many who feel, that we're asking them to do the impossible. And this is also a heavy burden on us as leaders. And I believe at times like this, it's a leader's responsibility and a leader's duty to give hope and to inspire. So how do we do that? I think there's a number of ways that we can do that. Probably most importantly is listening and learning and designing and planning our services with the public, with real people who use the services, making sure their voice is heard. They know, as do our frontline staff, making space and time to listen and to work together. I think another way, in fact, I know another way, and I think it's the only way we can go forward, is building trusting relationships across all our organisations, as we did during the pandemic, and at every tier of our organisations. Because this isn't about pointing fingers, this is about working together and owning it together. And we've got some fantastic examples in West Wales. I think some of the stars that shine are Aberaeron and Cardigan integrated care centres, and lots of other teams who work together. How we responded to the refugee crisis when we welcomed our Ukrainian friends across all organisations at the camp in Llangrannog, something we should be proud of. And I think another way to give hope and to inspire and to lead in these times is enabling and empowering innovation. And that's what you're doing in this conference. It shines a light in the dark of the challenges. I saw it this week when I went to a conference in Park y Scarlets with our nursing and other clinical colleagues, when they presented their innovative projects. Now, we talk about low staff morale. When people are empowered, enabled, and allowed to resolve issues based on the evidence, based on the data, based on their ideas and their experience, morale soars, and they can see a way out, and there is a way out, and it's inspiring, and it lifts us all. So thank you for what you're doing today. And I think another thing that we have to do even more of at this moment in time is to say thank you, is to recognise, is to listen to our workforce, and just to celebrate with them in some simple ways and some more complex ways. So this conference is key to that inspiration. It's key to giving hope. It is really important that we take time out to learn new ways and to look back so that we can remember and learn and even reintroduce things that worked before that we let go by the wayside. So I would like to thank each and every one of you today, everyone who's organised the conference, everybody who is Bore Croeso and good morning everybody. My name is Maria Battle.
Great, thank you very much, Maria. And it's very noticeable, having had a presentation from the Chief Exec of Haldar yesterday, and Maria's talk today about how they're looking at how they can support staff to make innovations. And we've often had talks here about innovative solutions to healthcare, but we haven't often had the really senior people in the organisation saying, actually, we know in the past we might have not helped innovation because of our culture, because of risk aversion, and because of the way we manage people. And perhaps this culture change is one of the most important things to allow the innovative and pioneering people we hear from here getting on with introducing the services that they know their communities need, and also allowing space for other people to do it without getting worn out on the road to doing it. We had a presentation yesterday from someone who'd introduced a cardiovascular app in North Wales for monitoring heart patients, which to someone not involved in the system seems a fairly simple thing to get off the ground. It's not rocket science, I wouldn't have thought. But she explained how difficult a journey it had been to just get this app up and running, although the satisfaction with it from both clinicians and patients was incredibly high. So I think if we can take that message from this conference, that for those who are in control of the purse strings and strategy, they need to leave the operational bit to those who actually are doing stuff on the ground, and just set strategy and not get in the way with various committees or whatever in the structure that, for the best of reasons in the past, have tended to get in the way of innovation. I think I'll get off my soapbox now. Maria is chair of the Mid Wales Joint Committee, and I'm going to put Peter on the spot now because he's actually in charge of the operational side of the Mid Wales Joint Committee. So if anybody has any questions about how the Joint Committee runs or anything, we can get Peter to answer them, or I could try, having been chair of it for a few years as well. If anybody wishes to know anything about the operation of the Joint Committee, please raise your hand. No? Do we have anything online, Anna? No. So the Joint Committee was originally set up, as I said, to solve the problems of the health boards not appearing to work together for the people of Mid Wales when the boundaries that people cross for their healthcare services did not match the boundaries that have been drawn on a map. And we were never set up in a way that we had executive power. We were merely set up as an organisation, as I put it, to bang heads together and make sure people were working together. And we've come a long way on that road. There's a long way to go still, but collaboration is key between all our statutory bodies in order that services are delivered seamlessly to people in the rural areas of Wales. It should not matter to the people whether they are a customer of a certain local authority, a certain health board. They shouldn't know who's in charge of their services. It should be a seamless service. That's my dream, as Martin Luther King once said. Anyway, I'll stop banging on now and we'll move on. So the next presentation we have will set the scene a bit for the day, which is a presentation addressing what I've been calling the triple whammy. Catherine has a much better title, which is the triple challenge of Brexit, COVID-19 and climate change, and what that means for delivery of health, what it means for well-being and what it means for equity in rural Wales. So over to Catherine.
Thanks very much, Jack. I'll just attempt to share my screen now. So let me know if you can see it. 1 second. Can everybody see that? I hope you can hear me as well.
Yeah, we can see it. Thank you.
Lovely. Thank you very much. So firstly, thanks for inviting me to come along to speak today. I'm sorry I can't be there in person, but it's great that we can do these things virtually now. My name is Kath Ashton, and I work within the Wales Health Impact Assessment Support Unit, and we are based within the WHO Collaborating Centre for Investment in Health and Wellbeing within Public Health Wales. So I'm here on behalf of my colleagues Liz and Michael today. And as Jack has already mentioned, I'm going to be talking about a piece of work we started about 18 months ago and published the rural element of it in April this year. So it's rising to the triple challenge of Brexit, COVID-19 and climate change. What do they mean for health, well-being and equity in rural Wales? So a quick overview of the presentation today. I'll start by giving a bit of a background to the project itself, defining what we mean by the triple challenge when we talk about it. I'll then go through the methods and processes we undertook to do the work and summarise the main findings we found from our strategic overview, which was an overview of the whole project itself, where we looked at all of the key determinants and themes which could impact on health and well-being coming from the 3 challenges. Following that piece of work, we then did the spotlight work, which was on the rural communities, which I think will be of most interest for you today. I'll talk through the main findings of that report, which we published in April this year, and also the opportunities that came through from that report. So a background to the Triple Challenge project. Since June 2016, there's been recognition of the wider potential population health and wellbeing impacts of Brexit. And while we were grappling with the challenges of that, COVID-19 obviously came along in 2019, where the concerns about the interaction of potential impacts between the pandemic itself and those we were already seeing through Brexit emerged. And then alongside that, there's the growing urgency relating to climate change impacts on health and wellbeing in Wales. So we saw this as an opportunity to do this piece of work, to look at the different impacts that were going through the 3 challenges and how they interrelate, to take an integrated approach in order to tackle the 3 challenges, which are happening simultaneously. So what do we mean by the triple challenge, or the triple whammy, as Jack's been calling it? For this, we mean the cumulative and individual health and wellbeing impacts of Brexit, COVID-19 and climate change. As I've already mentioned, these impacts are multifaceted, they're not static, and they will affect Wales in both the immediate and the long term. So the aim of this piece of work was to provide a high-level strategic overview of the complex interactions between the 3 challenges and the compounding impacts on health, wellbeing and inequity in Wales. So the methods that we used to undertake this work, the Wales Health Impact Assessment Support Unit were a very, very small team within Public Health Wales, but during when Brexit first happened, and then obviously when COVID hit, we had already been undertaking some health impact assessments within the unit on these particular challenges. So for this triple challenge work, we were building on the evidence and findings from these health impact assessments, which we'd already undertaken within Public Health Wales. For those of you in the room and online who aren't aware of what health impact assessment is, we refer to it as HIA. So it's a systematic and flexible evidence-based process. So it aims to identify the positive and negative impacts of policies, plans and events, such as Brexit or COVID or climate change, on the health and well-being of a population over the short, medium and long term. So the process itself is equity focused, and as part of the process, it highlights the distinct impacts for particularly affected vulnerable population groups. So as I mentioned, for the triple challenge piece of work, we were lucky enough to be able to use the health impact assessments that we'd already done within the unit as the basis for the work. So in 2019, the unit had completed a Brexit HIA and also an update and rapid review of that in 2019 as well. Regarding COVID-19, in 2020, the team published two HIAs. The first one being on the staying at home and social distancing policy and the impact of that of health and well-being in Wales. And then secondly, the health impact assessment of home and agile working on the health and well-being in Wales. And then thirdly, with climate change, this year we've recently published a health impact assessment of climate change. So looking at the health impact of climate change on the health and well-being of the population of Wales, and also a HIA of the reduce, reuse and recycle. So we were able to use these health impact assessments as a basis for the triple challenge work going forward. But also alongside that, we did some rapid evidence searches, both the academic and grey literature, to identify any more recent evidence that we weren't aware of when the HIAs were undertaken. This evidence was then appraised and classified into key determinants of health. So this is what we mean by this is the social, economic and environmental determinants of health, wellbeing and equity, which have been impacted by all of the three challenges, for example, transport and employment. And then under each of these key determinants, key themes, pathways of impact and population groups impacted were identified. So that's just a bit of a background to the methods and how we undertook the work. And the next sections will be on the key findings of the strategic overview, so the project as a whole. So as expected from the three challenges, we found that there were positive impacts identified, but also the negative impacts on the health, wellbeing and equity of population groups across Wales. And these were found to be immediate impacts, short-term impacts, medium, and also then long-term impacts as well. So as a basic overview of what we found that there were a wide range of compounding and cumulative health and inequalities impacts. Trade and free trade agreements emerged as important to all three challenges in Wales. But we also identified that there's a gap in the research and published evidence which link all of the three challenges together. What we did find, though, was that climate change was a common theme in both the COVID-19 literature and then also in the Brexit literature, but not many of them tried to merge them all together and look at the collective impact. What we also found in Wales are that there are key opportunities for us to take this work forward. So as we all know, Future Wellbeing Future Generations Act that we've got in Wales provides us with an enabling environment to address some of these potential impacts. There's also a window of opportunity for policy change and to promote opportunities or co-benefits for all, and also an opportunity for increased public health messaging about these challenges and the impacts coming from them. So that was just a strategic overview paper, which we published, I think it was September 2021. After we'd published that paper, we thought, right, it'd be good to drill down into some of the key determinants and key themes that we found, particularly the more prominent ones. So in October 2021, we published the first Spotlight report, which was on food security. And then the second Spotlight paper, which I'm here to talk to you about today, is on rural communities. and that was published in April this year. All of these papers are available on our website, and I put a link at the end of the presentation if anyone is interested. But what we found when we started to look into rural communities is that there's no one definition of rural or rural communities or rural health in Wales. So this posed a bit of a challenge when we started getting our heads into the work. And we also found that there was little dedicated evidence of the impact of the pandemic, Brexit or climate change on rural communities' health and well-being in Wales. We often had to dig around in the existing literature which focused on something else to find that impact on rural communities. So that was a finding in itself. Just a few key statistics that we used to sort of lay the land when we opened the report. I imagine the audience today will probably be well familiar with a lot of these stats, but in 2021, 35% of the Welsh population live in rural areas. In 2019, 25% of residents in rural counties were aged over 65, so obviously a lot of the elderly population. Access to services, for example, one survey undertaken in 2013 said 93% of respondents did not have a hospital within their local community. Digital infrastructure, compared to urban areas, there's a lot less. People were unable to access decent broadband. And then, for example, if we look at tourism, 16% of jobs in rural counties were within the tourism sector. So, it's a unique area, community. So I think it's good that we've got this report that drills down into the particular effect on rural communities themselves. So the aims and methods of the rural paper. So the three main aims, similar to the overview paper. The first one was to enable a better understanding of the potential positive and negative impacts of the Triple Challenge on rural communities. Secondly, to provide an overview of rural population groups affected. And then thirdly, articulate potential actions for the future. All of this is based on the available evidence that we found through the HIAs and our subsequent rapid evidence searches. And then we also additionally for this piece did a few key interviews and focus groups with key stakeholders in Wales as well to give that different perspective. So the key findings from the Rural Communities report, as I mentioned previously, we found that there was a gap in existing evidence which shows rural health and rural communities as the main focus within the Triple Challenge area. We found that rural communities are impacted by the Triple Challenge in many ways, some of which are the same as urban communities, but others that are more specific to rural areas. For example, around housing, age, transport, and active travel infrastructure. Rural environments and communities have become much more attractive to live and work in during the pandemic, which has led to both positive but also negative impacts. Digital infrastructure and accessibility came out as both very important, as is increasing digital literacy within rural communities, as these can all impact on health and well-being. And finally, Brexit could also present an opportunity to develop innovative and transformative approaches to the rural economy in future years. So that's just a very quick overview of the key findings. Again, there's more detail in the report, but I just haven't got the time to go through everything today. But the population groups that we found to be affected by the Triple Challenge in rural communities, obviously the whole population, everyone who lives in a rural community has been affected by the Triple Challenges, either individually or cumulatively. But we were able to pinpoint certain population groups within rural communities which were more likely to be more affected. And these are those with pre-existing health conditions and needs, children and young people, older people, local businesses, critical workers, fishers, farmers and agricultural sector workers, those on low incomes or unemployed, and then employees themselves. So after identifying the population groups, we also identified the key determinants of health and well-being which were affected by the Triple Challenge. And these were split into social and community factors, environmental factors and economic factors. So firstly, we look at social and community factors. the key themes identified were access to health and social care services, access to digital and communication services, and movement of people and migration. If we look at environmental factors, transport and active travel emerged as a key theme, and also the local built and natural environment. And lastly, the economic factors. So food production was a key theme, tourism and hospitality, local foundational economies, and also employment. So within the report itself, we looked at each of these key determinants and the key pathways and themes, and we highlighted whether they were positively or negatively impacting on health and well-being, and then also looked at the opportunities as well, which could come from each of these. So I've got one example, because obviously I can't go through all of them today, but I've got the example of health and social care. And we found this was mainly around access to services within health and social care. So as you can see from the table, and this is the way we present it in the report, we've got that all three challenges impacted positively, but also negatively on health and well-being of population in rural communities. And those specific population groups affected were those with pre-existing health conditions and needs, older people, and then also critical workers. So what we found from the literature was that COVID and Brexit could help to accelerate the rollout of new models of healthcare working, such as digitalisation. For example, less travelling to appointments, and this may benefit those with chronic conditions who are frequently having to access healthcare, or those on low incomes who maybe can't afford to travel to the health services in their local area. The COVID-19 regulations also affected the population's ability and confidence to travel to access health and social care services, with rural communities being particularly vulnerable, maybe because of the older population who live in these communities. Rural communities also have longer waiting times than urban areas, and we also found that travel, for those who don't have access to a car, deters some patients from accessing health and social care services, particularly during the COVID-19 pandemic. Regarding Brexit, obviously the recruitment and retention of health and social care workforces was challenging in rural communities, and those living in rural communities are vulnerable to the impacts of climate change on transport links and infrastructure. For example, with the extreme weather events we've seen this year causing difficulty for some to access services, and also for staff to actually get there to provide the service. But we did also identify opportunities. I think, as Jack mentioned earlier, the challenges have provided some opportunity to develop new models of working or retain some practices adopted in the pandemic. So we've done a summary of this for each key determinant that we identified through looking at the existing evidence, and these are more detailed in the report on a whole. And finally, opportunities. So this is just a summary. There's more detail in the report, and these are opportunities that we identified through looking at the literature. These are not opportunities that we, as Public Health Wales, say we should be doing in Wales, but it's what we found by looking at the evidence that is out there. So the development of a specific policy framework for rural Wales, covering the wider determinants of health, wellbeing, and the triple challenge, could be an opportunity for the future. Increased focus on mental well-being and developing solutions to support rural populations. We identified an opportunity for local authorities to use existing Welsh Government policies as a platform to enable digital literacy, inclusivity, and digital infrastructure. Involving key urban and rural stakeholders in identifying critical land use infrastructure needs to support and strengthen food systems could have a positive impact on health and well-being. The opportunity for collaborative working between local authority and other sectors with the use of place-based approaches that involve local individuals. Ensure future planning takes into consideration the interconnection between urban and rural communities and not seeing them both in isolation. Another opportunity would be to explore and consider ways to reduce climate change effects to enhance rural communities. Create or enhance local rural communities in Wales, building on the changes witnessed during the COVID-19 pandemic. Opportunity to establish a commission on rurality as a driver of future policy and research activities. And then finally, the opportunity of prioritisation of a policy framework for post-Brexit rural development funding. Like I said, these are opportunities which emerged from the literature and for stakeholders to consider going forward. So that is the end of my presentation. Thank you for listening and for your interest in our work. It's always good to be invited to come along to events such like this to talk about what we've been doing in Public Health Wales. I've put our contact details on the screen and also a link to the Wales Health Impact Assessment Support Unit website, but also a direct link to the paper on rural communities if you're interested in having a look.
Great, thank you very much, Catherine, for that run through what I know is a much lengthier document for those who wish to read it. If you're okay to hang around, we'll take some questions now.
Yeah.
And yeah, well, I I have to remember that I must look at the camera and the microphone so people online can hear me, because I tended to look at the screen and the person I was asking the questions of yesterday. So one thing that's come to mind is that since this study was done, you've got a fourth challenge that's entered the equation, which is the war in Ukraine and the cost of living crisis, which I think one example where it might affect rural populations more than others, if the alleviation on energy prices has been done on gas and electricity, whereas most people who live in rural Mid Wales depend on oil for their heating or possibly liquid petroleum gas. And I was wondering if you were considering adding that into the mix of work you're doing on this.
Yes, I was going to mention actually in the presentation that obviously since we've completed this work, 2 new challenges have been brought into the mix, and you've just mentioned the war in Ukraine and the cost of living crisis. I know the cost of living crisis is something that we are interested to add into the mix with this piece of work. And I think it might be on the horizon. I'm not making any promises, but we are obviously a very small team. So we are going to try and look into it. But again, this piece on its own was a big enough piece to do, as you can imagine, because there's so many different interlinked factors, and the wealth of literature out there is huge, that it would definitely have a huge contribution on health and well-being of rural communities, those 2 additional challenges. So watch this space.
Great. There's a question come online, which is what did you learn about the voluntary sector's contribution to well-being in rural areas when you did this research?
We did definitely in the strategic overview paper, there was definitely a lot more that came through the literature about the impact of the voluntary sector and the voluntary contribution of individuals in communities themselves. I don't think it came through too strongly within the rural one standalone, but it definitely came through in that overview paper. So if you want to have a look at the overview paper online, obviously it was definitely a positive theme that came through relating to improving people's mental well-being, feeling like they're contributing to the whole movement. So that definitely came up a theme in the overview one, but not so much in the rural one. But you know, doesn't mean it didn't happen. It means it happened probably everywhere rather than just specifically in the rural communities. Great,
thank you. And there's a question from the floor.
Yes, thank you, Catherine. That's incredibly ambitious presentation, ambitious kind of goals, those 3 elements together. I'm interested in the opportunities. I'm very familiar to hear anybody say there's opportunities from Brexit. And I guess without reading your papers, I'd like to see the detail of that to imagine that there could be some opportunities there. Because in Europe, I guess so much about the negative aspects, I'm always keen when somebody says there could be an opportunity, I'm really keen to see what that could be.
Thank you. I believe sometimes people online can't hear the questions from the floor. So the question was to asking Catherine to expand on her opportunities and her optimistic message in the paper. Over to you, Catherine. You've got all day.
Well, obviously at the end there, I did note the opportunities which could be potential for Wales. I mean, I think there are opportunities. As I've mentioned, there were a lot of positive impacts that we noted through the work, and a lot of these changes, innovations can remain going forward to help improve the health and well-being of rural communities in Wales. And I hope that this report has highlighted some of those to our key stakeholders. I know Welsh Government were interested in the report when it was released in April, and you know, we can do what we can for lobby for the opportunities that we found. But I think there is optimism, as obviously, as well as the negative impacts we found. But there's definitely opportunities in Wales to take some of those things forward, hopefully.
I think the question related to opportunities from Brexit, Mary.
I can't hear, sorry.
Opportunities from Brexit.
I take your point, I think that I often do that just to guess, also people want to, you know, concrete examples.
Sorry, I couldn't hear that addendum. Opportunities from Brexit, I think we wanted expanding on as well. Sorry, I'm not hearing clearly here either.
It's okay. I think the Brexit stuff, I'm not going to lie, is more Liz's bag. She understands a lot more about the funding and bits like that from Brexit. But from one of the opportunities that we did found were around the post-Brexit rural development funding. That could obviously have an impact on health and well-being in Wales and taking that forward. But I'm not going to try and speak to something that I'm not fully clear on. But in the report, we have got a lot more about the positive impacts that could come from Brexit going forward.
We have another question, yeah.
Hi, Catherine. I just wanted to ask about like cars on the road. So people living in rural areas, they do need to drive to get to a lot of places, but over the pandemic and everything, a lot of digital services, as we know, has developed really, really well. But there's still a lot of services that haven't gone over to digital. Some of that's down to confidence. So what would you say would be the best way to try to encourage that to develop the confidence to move on to these areas? Because in the UK, 1 out of 20 cars are to do with the NHS, and that could be people going to appointments and things like that. So that's a big impact on the climate change that we face today.
Thank you. The question from the floor was, how do we encourage more uptake of digital solutions? Because 1 in 20 cars on the road in the UK are involved with either work or a trip to the NHS. So I don't know how you feel on that, Catherine.
Is that uptake from patients and service users, or services themselves offering digital services?
Both, please.
Both. Well, with services themselves, I'd get those case study examples of where it's worked and where it's had a positive impact on individuals. And I mean, we've got quite a few references to that within the report itself on how some have had such major positive impacts for both staff, the services, and the service users themselves. And in regards to encouraging more people to uptake in digital services themselves, like the service users, I don't really know what the answer to that would be, apart from just encourage it as much as you can, I guess, and show the benefits to them of doing it, to the benefits to them, but not only the benefits to them, but to the community, to the climate, and also to the hospital services themselves. If people can see the benefit of something, then they're more likely to uptake it, I guess. But I think it's a challenge that we're all having to tackle at the moment.
Thank you. Any more questions from the floor? I just wondered, in your presentation, there was a particular point where you said that people in rural areas face longer waiting times for services. Did you find out why?
I'd have to go back to the report itself to check. Can't
Would,
think off the top of my head.
would there be a why in the report, or would it be just reported as a fact?
I have a feeling it might just be reported as a fact, but I can double check that for you.
Yeah, sorry
Yeah.
to put you
No,
on
no,
it.
it's all right. Like you said, it's a lengthy report, and there's lots in there. So yeah, I encourage, if you're interested, just to have a read through it yourself and have a look.
This has been an issue that's been raised before, that but it's mainly been sort of apocryphal tales that people in waiting areas, in rural areas, face longer waiting times. But if there's hard evidence,
Yes.
we need to find out why, so that we can do something about it. So,
Yeah.
yeah, that's great. And one more question from me, hopefully not putting you on the spot again, is you mentioned a commission to help in the development of a rural strategy.
Mm-hmm.
How do you see that working?
I'd have to look back at the report. I'm having a look now. I think, yes, I found it in the report now. I think it was learning from a commission that was undertaken in North Yorkshire. So I think it was a recommendation that, or an opportunity that we could follow what they've done in Yorkshire and look how a commission could be replicated in Wales to help drive future policy decisions and influence those key stakeholders.
So there's an example in Yorkshire of
yes, so the North Yorkshire Rural Commission. So there's a reference in the report on that. So.
But I think there's an example in Scotland as well. So I think for those who are interested in seeing how it might work, there are 2 examples there they can look at. Great. Do we have any more questions? Sorry. Yeah. We'll put the link to the report in the chat box for you, if we may. Thanks, Catherine.
Yes, no worries at all. And yeah, if anyone has any further questions, feel free to get in touch. And
you kindly gave your contact details, so I hope you don't mind if people contacted you outside this meeting.
No,
great.
Not at all.
Thank you very much.
Thank you very much.
Thank you. Now, in order that Anna's not too horrid to me, because we're running about 5 minutes ahead, because everybody's been good, which is normally the opposite the chair has to deal with. We'll have a 5-minute comfort break before we have our next presentation. And that means that anyone online who's tuning in for a specific thing won't be surprised. So if you could get a coffee or whatever you need, especially those who had to rush in late, we'll start again at 11 o'clock. Thank you. if you want to take your seats again. That 5 minutes went rather rapidly. So our next speaker is Amanda, who I have great pleasure in introducing to the conference. One of the big projects we set out on when we were formed as the Mid Wales Joint Committee was to establish appropriate training so that we had a rural workforce that was appropriately trained, wanted to live in rural areas and wanted to work and do exciting things in rural areas. So I'm not going to steal any of Amanda's thunder, but it gives me great pleasure to introduce Amanda, who's going to talk to us about nurse education in Mid Wales. Thank you.
Diolch, Jack. Thank you, everyone. Diolch am y gwahoddiad I ddod yma heddi. Many thanks for the kind invitation to come and speak to you all today. So for the ones that don't know me, I'm Amanda Jones and I'm the Principal Lead in Healthcare Education. So I head up the nursing within Aberystwyth University. So my talk to you today is just to update you in relation. Some of you may be aware, some may not be aware of what we've developed so far within Aberystwyth University. So it's taken us about 2 years to get to this point, which has been a really exciting time for us within the university setting. And I'm going to kindly ask Anna to go to the next slide for me, please. So this picture was on the 5th of September this year, and this is where we had our very first cohort of adult and mental health nursing students start within Aberystwyth University. So like I said, it's taken about 2 years for us to get to this point. They are commissioned numbers through Health Education and Improvement Wales, and we've appointed 51 into those roles, 13 mental health students and 38 adult field students. So they started fresh students on the 5th of September this year, and I must apologise that I don't have any students with me today on this day. This week is their very first week out in clinical practice, so it would have been unfair of me to pull some of them out from their clinical placements in their very first week. So myself and the team feel very blessed. We were quite emotional on that first morning to welcome those students onto campus. So they all go through an application process and an interview process, and we were fortunate enough to have nearly 380 applications for our 51 places, and we did over 241 interviews for those places. So our cycle is open already, and we're continually on that treadmill to start appointing for next year, for next September. So we only have a September cohort at present, and we will have our first interviews or student selection events starting in December this year. Technology. So our team within the Healthcare Education Centre, so my background is that I'm a registered nurse. I've been a registered nurse for 30 years, a background of children's nursing, and I'm also a specialist community public health nurse. I'm a health visitor. I trained within the Mid Wales locality in Bronglais Hospital nearly 30 years ago, which is directly opposite our Healthcare Education Centre, and we've got a variety of backgrounds within the team as well. We have Angharad, who is about to submit her PhD, and her work has been around rural and retention of nurses within community and urban settings. And we've got Gwyn then, who's also an advanced nurse practitioner, and he joined the team early on this year, and he leads on our clinical skills and simulation within the team. Then we have Devi also. Devi has a background of A&E nursing and was a team leader there, and she's also delivering some of our clinical skills and simulation within the team. We have Darren and Blevin then, who are mental health nurse lecturers. So again, a variety of background and specialisms within the team. We have Chantal, who's our placements manager. So she has had the huge task of mapping 153 placements. And what we've done for our students, which has evaluated exceptionally well, is that we've mapped the students, their placements across the whole of the first year, so they know exactly where they're going for the year ahead. We also promote a family-friendly programme. So for our students who may have care responsibilities, our lectures don't start until 10 o'clock in the morning to ensure that we can support those individuals in accessing the education as well. Fionn and Stuart are registry managers, and they support us from the academic side, quality assurance, ensuring that everything is in place for the university and for our students as well. And in the middle there, you can see a cat. We've got our local mascot, which is a local cat called Toucan, and he comes to visit us every day in the centre. And recently we had Cariad Pet Therapy come and do some sessions with us for the students around the importance of pet therapy within healthcare, but also a two-pronged approach to support the well-being of our students. So the way that our curriculum is written is that our students have lead lectures on a Monday and Tuesday. Wednesdays are called Wellbeing Wednesdays. It's a non-teaching day for the students to support their well-being. And on Thursdays and Fridays, they have clinical skills, small group work, large group work, tutorials. So Toucan is a daily visitor at our centre, and we did feel that from our open days, which we do have one coming up on Saturday, that we felt he should be part of the team now because he does come to the centre daily. And then we have Branwen, who's our registry officer and is front of house as well, and really supports our students and is usually the first person that they see when they come into our healthcare education centre. Diolch, Hannah. So these are the photos again of our current nursing students on their very first day. So they were really thrust into the spotlight, bless them, on the very first morning that they started within the university setting. So the team, you can see, so as I talked already about the split, and that's dictated by Health Education and Improvement Wales to how many students we appoint into each field of practice. So we'll find out our numbers now, probably in the beginning of the new year for next September, but we'll continue that recruitment drive in the interim to ensure that we are able to fill those places. We did have, in the end of September, the Welsh Health Minister came to officially open the Healthcare Education Centre, and some of our students volunteered to be part of that day as well to talk to individuals and key stakeholders. So we do work with stakeholders within Cyhadledd University Health Board, Powys Teaching Health Board, and also Cyhadledd, as well as our care home education facilitators. But I won't steal their thunder because I know that they're about to present after me to talk about their initiatives and their drive as well. But we work very closely in partnerships with all our key stakeholders, and we're fortunate to have some of those experts come into our university to deliver some of the teaching to our students as well, to ensure that they have that varied learning experience. So just to talk to you a little bit then about what we've developed within our Healthcare Education Centre. When I first started working up in Aberystwyth University, I was really passionate about ensuring that we had dementia-friendly status within the centre. It was really important for us to be able to see that from the onset of entering the centre. So some of the bids that Bleddyn and I worked on, which we were fortunate to get around this time last year, and we worked with a company called REMPODS around our vision for dementia care and educating our healthcare students in order to support those service users out within our Mid Wales locality. And some of the bids that we developed and our vision was around the reminiscence therapy for service users as well. So as you can see, in the furthest corner there is one of the main walls that when you come into the centre, we have that video that changes every 20 minutes. So again, it's very relaxing, very calming for service users and students as well. And I've often come out to the main landing and often see a member of staff standing there just engaged in that as well. We've also invited senior nurses, senior workers, heads of services from our key stakeholders to come and have a look at our centre. And again, after today, if any of you would like to get in touch and have a look around our centre, we would be more than welcome to show you around. One of the bids that we worked on as well is around the train carriage room. And again, this is working with REMPODS. And REMPODS was a company that was on Dragon's Den a few years back. And they're really involved with developing reminiscence therapy. So this is a moving train carriage screen that runs on a loop for about an hour and 20 minutes. And again, is used within care settings for vulnerable adults and reminiscence therapy. And we've also invited up the Woolwich organisation for homelessness recently, and they were fascinated by this concept and are now exploring those avenues themselves as well. The middle picture there, having been a community member of staff as a health visitor, I was passionate about ensuring that we had a community simulation room within our facilities also, because working within a hospital environment and a community environment is totally different. And we have to remember that we're invited guests into somebody's home environment as well. So we developed a community simulation room, again, working with the team, working around their experiences and knowledge as well. And we've set up this lounge, and we've been really fortunate that what we've furnished that lounge with have been from community donations. I put a plea out on social media asking members of the community, have you got a rug, have you got a chair? And I found myself driving around roads in rural Ceredigion late at night picking up these items of furniture from people's home. But we're really honoured to have been given that opportunity. So this community simulation room has things like the rugs as your trip hazards. We've got fires in there, extension leads, again, as your fire and trip hazards. My background is in safeguarding and child protection as well. So I've got things like children's books in there. I want students to pick up on assessments, whether there are any safeguarding concerns. And we've also scattered around empty bottles of alcohol as well, again, so that they can pick up on those assessment skills. Diolch, Hannah. So just for you to have a look at our clinical skills rooms, I'm not going to go into depth about this because one of my colleagues is doing a bite-sized presentation this afternoon on clinical skills and simulation. But alongside our community simulation room, we've also got 3 clinical skills suites. One of them, clinical skills room 1, is high fidelity, high simulation, and that mimics an A&E resus. We also work with Cardiff Carers Project within our building, which are 3rd year medical students who choose to do a rural placement in Mid Wales for a year. And they have their teaching with us within the building every Thursday, supported by Dr. Sue Fish, one of the local GPs. So we do some collaborative clinical skills teaching with our nursing students and medical students. And our vision is by the time our nursing students get to 3rd years, we'll run a major incident event in the centre, something like a road traffic collision on the way to work. And those medical students and nursing students will have to work together in assessing those patients. So it has been a lot of work in engaging with services such as the ambulance service, police, fire and rescue, RNLI, mountain rescue, to ensure that we can all work together and collaboratively to support our students and the developments within Mid Wales. We also want to build resilient skills within our future generation of nurses as well. We've got clinical skills room 2, which mimics a 4-bedder And again, you can access the community simulation room from that room. So they have their skills around bed making, breakaway training for violence and aggression, manual handling, venipuncture, cannulation. All those skills will be simulated within these safe environments for them. Also within Clinical Skills Room 1, we have a 3G Sinman Plus. And again, very realistic, very lifelike, can change colour. We can put the mannequin into cardiac arrest. We can mimic a collapsed lung, for example. His name is Di. We ran a competition for our students to name all of our mannequins, and they came up with the name Di. So Di now sleeps in Clinical Skills Room 1, and he blinks and he can do a bit of everything. But we've also got cameras and microphones installed also on 360-degree cameras that we can run these simulation scenarios with the students. And they're able to debrief and look back at these as well. So it's within a safe environment for them. We've also got the digital infrastructure in place in every room that we can live stream all of these sessions as well. So if we were running a simulation event with a senior paramedic or fire and rescue, for example, we don't have to pull those students in. We can live stream those scenarios for them as well. So when we think about accessibility, we're ensuring that we're inclusive to all of our students then. Clinical Skills Room 3 is more around anatomy and physiology. So we've bought all the models, we've purchased the models, we've got male, female catheterization, stoma care, we've got the heart, the liver, and the students can really pull these apart and learn about the anatomy and physiology and sit together and learn these opportunities as well. Hannah. We'll get there now. What we've done as well is we've developed a virtual family, and we sat together as a team for a day and developed this virtual family who are based on a typical rural farming community in West Wales. So we've got Mam Gi and Datki, grandparents at the top there, and sadly they've all got medical problems. So just to give you an example, Mary on the top corner there. So Mary likes to go to Morrison's shopping on a Saturday and meeting her friends for a coffee, but she starts forgetting to take her shopping list with her. So by the time our students are in year 2, Mary will be seen in an assessment clinic, and by the time they get to year 3, she'll have a diagnosis of dementia. So any teaching that we do with our students is revolved around our virtual family. So Becca is 17 and she's a college student doing access course. She finds herself as a teenage pregnancy. So we're working with services at the moment to look at perinatal and postnatal psychosis to bring that into her care as well. So they will all have Ahmed, who's their adoptive son, has a peanut allergy. So again, any teaching that we do with our students is linked to the virtual family. And we've got David, who's got cardiac problems. So again, if Devi or Gwyn are delivering a session around the heart and cardiology, they link it, so it makes it a little bit more realistic. So the idea being, by the time our students get to 3rd year, they will really know this family inside out. But we've also got opportunities working and involving our students in developing this family further and bringing other characters into the family as well. But it's one of the key posters that are on both floors within our healthcare education centre, so that people are introduced to the family from an early onset. So the Welsh language is key. We have Welsh speakers within all fields of our nursing who can support Welsh speaking students, and every Welsh speaking student is matched to a Welsh speaking personal tutor from the onset when they arrive. So 50% of our programme is available through the medium of Welsh and supported by practice assessors and practice supervisors who are Welsh speaking out within their practice placement opportunities as well. And also what we've done throughout the 3 years is that we want to develop Welsh language skills for non-Welsh speakers as well. And what we've developed is a Cornel Coffee a Chlonc, which is a coffee and chat corner. And they're led by some of our students and our Welsh speaking staff as well. where we promote, it's not about making people fluent, it's about learning the basics such as the word for pain, parts of the body, so that they can really support the people that they care for and not have a misunderstanding of the care that they receive as well. So what next for us? So it's taken us 2 years to get to this point, which has been fantastic, but I get the question all the time, what next, Amanda? So coming up shortly, we have the Nursing and Midwifery Council, who are our governing body as nurses, hopefully coming to approve us for a return to practice programme. So again, these are commission numbers through Health Education and Improvement Wales. So we are fingers and toes crossed that they will approve us imminently so that we can develop that programme further and deliver that in the new year pending approval. We've put a bid in to look at level 4 programmes for healthcare support workers, and those programmes would be mapped to the first year of nurse education. So that gives opportunities to those students who would like to progress to get into nurse education, who may not have the traditional qualifications of A-levels, for example, so that it makes it accessible to all. So we're waiting for that outcome currently, and that course would be part-time over 2 years. So I'm happy to have those discussions if anybody would like to know anything further. Now, being a health visitor myself as background, the new tendering comes out next year for some of these programmes. So I would be silly not to go for them. The team are just looking at me bemused when I come up with these ideas. So next year we're hoping to tender for the specialist community public health programmes for health visiting, school nursing, and we're also hoping to go for the SPQ programmes, which are the specialist practice qualifications for district nursing and community mental health nursing as well. And this is to support our practitioners and develop the workforce within the Mid Wales locality, giving those opportunities to those individuals and practitioners within the locality to hopefully keep them within the Mid Wales area as well. So lots of things happening in the future for us within the university. So as I've said at the very beginning, the timelines can take, because I often get emails and calls weekly saying, are you going to be doing midwifery? Are you going to be doing children's nursing? So it's important to explain so that people understand the process and the timelines that it takes to develop these programmes. As I said, they're commissioned places as well. So contracts are for 10 years at a time. So we have to consider looking forward to the 10 years, what we would develop further in relation to those as well. So by the time we have to tender for those commissioned places and also go through Nursing and Midwifery Council approval for those as well, it does take a bit of time. Just this week, I've been in discussions with social care around how we could develop things in relation to social care, whether that's social work degrees or how we can encourage more people to come into the social care sector. So watch this space in relation to how things develop there. But it's a really exciting opportunity for us to be able to work collaboratively with social care as well. We've currently got a post out for a clinical skills and simulation technician. So if you do know of anybody, have a look on Aberystwyth. There's a plug for me now, website, if anybody's interested in that role. So it closes on the 15th of this month. So it would be fantastic to develop our team further. And that's a non-qualified post. So you don't need to be a registered nurse to be able to apply for that post. And again, like I said, it depends on our tender outcomes, but we hope to develop to have more lecturers. We're 6 academics within the team currently, and we're all working on different projects as well to develop and raise the profile of the Healthcare Education Centre. Service users, carers and public involvement are also a really important aspect of what we provide within the Healthcare Education Centre, and without their support we wouldn't get very far. We're fortunate to have Jack sitting as a key representative on our service users and carers and public involvement, and we collaborate with our service users in relation to how they feel our programmes should be delivered and how they should be developed. And they also come in and give talks to our students as well, because there's nothing more powerful than a service user talking to students about experiences to be able to inform their education as well. They are also key stakeholders within our interview days. So they'll also sit with us on the interview panels to be able to appoint students, and we really value their input as well. So, diolch yn fawr am wrando. Thank you for listening, and I'm happy to take any questions. My contact details are there. So if anybody does have any questions after today or would like to get in touch to come and have a visit to our centre, there's always coffee and cake. That's all I'll say. Diolch yn fawr.
Thanks very much, Amanda, and having been involved as a grumpy farmer with the introduction of the nursing school, it saddens me to think that I'm more aligned to the dad key, the grandfather in that family, than any other member of the family. Hopefully my progression won't be quite as fast as his for the 3 years. So if anybody has any questions for Amanda from the floor, please raise your hand. Yep. Can we, Anna, take it there?
I am previously to Wisconsin University, so not competitor. I just, congratulations first of all, it sounds amazing, and I love the idea of the virtual family, fantastic. I wanted to pick up on a point you mentioned about talking to social care. We find that very difficult. So I just wondered, when you say talking to social care, who is it you're talking to? Is it Social Care Wales or different organisations?
For those at home, in case you can't hear, the question was how Amanda's going to get involved with social care, whether it's nationally or locally.
Thank you. Yeah, so the discussions we've had only this week actually were with heads of services for local authority, and they've got in touch with Social Care Wales so that we can start those discussions. So there's no concrete plans at the moment. It's just having those initial discussions to see what we can do to support each other.
However, having had a presentation with colleague Ceredigion yesterday, and they're here, I might lock them in the loo together over lunch, so see what comes out of that. Have we got just any more questions from the floor while I try and take a question offline? Yeah, there's a comment sort of question online about how you came up with the idea of the family so that it could include various attributes of different ethnic groups without it becoming tokenistic.
Absolutely, we do have experts from LGBTQ plus as well, and something I didn't mention in relation to one of our virtual family is Jack, the young lad. So he will represent and will develop. We take advice from those specialists within that subject. And again, we'd be open if anybody does have any suggestions. You know, we're at the very beginning of this, so we're always open to develop things further. So if I totally respect anybody's input, and if they want to get in touch and make some suggestions, we'd be more than open to that. So thank you, Dion.
Great.
Anything else?
Thank you, Amanda. In order to stick to time, I'm going to have to let Amanda escape now, but she has kindly shared her contact details and she's in the room, so please grab her if you wish to talk to her or contact her online. It's now carrying on with the idea of education, and one thing that's since we've had all these developments of education in Mid Wales, one thing that crops up now and then is where we're going to get all the placements for these people to be educated. So I'm going to hand over now to a couple of ladies from HCIW who've got the solution to all our problems. So I hand over now to Sarah and Bernadette. Thank you.
Bore da pawb, good morning all. I'm Sarah Kingdom Mills and I'm one of the 3 care home education facilitators that we have got here in Wales. One of my colleagues, Bernadette Evans, is with me today and our other colleague, Claire Hall, is actually online today. So there are 3 of us in total. Anna's going to be putting our presentation up shortly. Okay. So the 3 of us are regional leads across Wales, across different areas within Wales. We are all registered nurses with quite different backgrounds. Myself, I'm a learning disability nurse, spent a lot of time working in a range of different learning disability areas, and then also working within practice education. My colleague Bernadette here is an adult nurse, has got a lot of experience working in acute settings and with older persons, and then a lot of academia experience. And Claire Hall, also an adult nurse, experience in acute and community working, and Claire's also a health visitor as well. So that is the 3 of us. We are all employed by Health Education and Improvement Wales. Okay, so I think everyone would agree, you know, we have got a challenge with recruitment and retention of staff. You know, we do hear that all the time across all areas. And in order to challenge that recruitment, you know, we do need to change something around it. So our student numbers are increasing across Wales, and we know we need to increase those more to meet the demand of the workforce, and that's across health and social care. So we are looking to promote, develop and support student placements, but also ensure that showcasing a viable career pathway for those within the social care sector as well as in healthcare. Narrowing the gap between the health and social care sectors that we've got. So big task in front of us in terms of what we're looking at, but I think everyone will agree sort of that our challenge is there. So this is just to give you an idea of the numbers of nursing students that we've actually got commissioned within Wales. It does show you over the last sort of 20 or so years, but you can see that big increase that we've had over the last perhaps 6 years. The numbers have doubled in terms of our commissioned figures of student nurses. And all of our pre-registrating student nurses do require 50% of their time spent out in clinical placements, as well as 50% of the time within academic settings. So some key points there just to look at. We have still got the bursary arrangement for our students here in Wales. So that is a benefit to us. And we have also got a tie-in system for our nursing students with a streamlining process within Wales that is across shared services and Health Education Improvement Wales. So we are looking at that. And you can see between the year 2020 and up to 23, we got just under 6,500 student nurses within the programmes at the current time. So this is the level that we're dealing with. So you can see sort of the number of placements that are required to support that additional learning within the practice areas. So this is where we are coming in then, because on the next slide, this is just showing you the numbers of capacity in terms of NHS and then care home capacity of beds within the areas. You can see they are sort of heavily outweighed in terms of social care. So when we think about our numbers of placements that we've got for our nursing students, because that's our initial area of focus is nursing students, but we will be looking at other healthcare students moving forward as well. But I can see that the bed numbers, you can see very much higher, which I'm not sure whether that would be sort of a familiar concept for you, or you're unsure about the differences within the numbers there. And at the moment, the majority of our student nurses have probably, I would say, at least 8 of their placements. Some areas have 12 placements over their training, some have 9, depending on the universities that they're in. But the majority of those placements currently are within NHS settings, and they are over capacity within a lot of areas. So you can see sort of we're trying to build up the care home sector in terms of supporting students. So it's not a completely new initiative. We do know that care homes have been supporting students out there, but what we are looking at is a sustainable process, looking at the governance arrangements around that to make sure that any area that's created as a placement can be sustained moving forward for our students. So to start off, the role itself started as a pilot back in February 2021. So coming up 2 years really that we've had the first chef, care and medication facilitator here in Wales. So I was lucky enough to take on that pilot role within Carmarthenshire. So it was focused on one local authority area within the Hywel Dda footprint, supported by Health Education Improvement Wales. And initially, when I was looking at scoping out the areas and the care homes within Carmarthenshire, there are around about 120 care homes in total within Carmarthenshire. But a number of those have got nursing provision, and there's a high number of them that have got residential provision, and obviously there's that flexibility to have the two. But when I started looking at it, across all the areas in Carmarthenshire, there was one home with nursing provision that was supporting 2 students on an ad hoc basis. That's sort of the level that we had. So you can see sort of how much additional input we could have just across one local authority area by focusing on the learning that can be had within those areas. Some of them, I said, I have been looking at local authority areas, independent and third sector arrangements. So it's not specific to one particular type of care home then. And during the pilot, I was quite keen to ensure that we were looking across all areas. So not focusing on older persons' homes, but looking at areas where there's mental health, where there's learning disabilities, some of the residential care homes for children, to make sure we could support our 4 fields of student nurses moving forward, because that's so keen in terms of our future nurse standards and proficiencies that we've got from the Nursing and Midwifery Council, that we need to ensure that all students have got exposure across all of those fields of practice, as well as having opportunities for interprofessional education as part of their training as well. So these are some of the areas. So these are just some of the care homes that are actually now set up as practice learning experiences or placements for students within Carmarthenshire. So this is just to give you an idea, this graph, around some of the work that's been done, and it is focusing, starting off with a pilot in terms of the chef role. I say where I started from, there was one home that had an educational audit supporting 2 students. That was the position we had within Carmarthenshire in February 2021. A couple of other homes then with sort of the engagement across areas. I know there's a question earlier about social care engagement. And I'd say as a chef team, as we've moved forward, we've done quite a lot of engagement across those areas with social care, linking in with Care Forum Wales. We have got direct links in with Social Care Wales, Care Inspectorate Wales. So we've got a number of different arenas that we actually link in with to showcase what it is that we're doing. But in terms of this graph, you can see sort of that 4-month period in, there was a number of homes that had started to engage and to actually support students, because we have looked at a full governance process around how that's going to happen to embed it. And then quite higher numbers in terms of the end of the chef programme. So it was initially for 6 months, but there was additional funding made available to support it through until December last year. And then in January this year, we received Welsh Government funding So there was 3 regional care and medication facilitator roles to support the whole of Wales. So for myself and Bernie, we'll look at the regional roles shortly. These statistics are just showing sort of the South West Wales region, which are my coverage areas at the moment. So we have done a lot of strategic engagement events around that. We've made a lot of contacts across social care. I say we have been establishing a national care and medication steering group with the support of quite key stakeholders to make sure that we've got a focus on our work moving forward. We've got links in with the community infrastructure programme that's going on across Wales. So we've got lots of developments actually going on within the areas there. Some of you may have noticed there's been a slight change at the bottom of the slides there, because during the pilot phase as well of the chef programme, I was a successful applicant and I've been to one of the Bevan exemplars on cohort 7 for a project around this development work to see how it can be adopted and spread then across Wales. So I think sort of in terms of where that move on is into the regional roles, you can see the spread has started to happen. Now we need to see sort of how we can adopt this sustainably really moving forward. But from some of the regional events, then towards the end of the slide, which is showing up to September this year, I say it is only for one of the regions, you can see sort of that high increase in terms of where I started from in February last year, moving across and up into the areas there. So I'm going to hand over now to my colleague Bernie to pick up some of the rest of the slides.
Thank you, Sarah, and good morning, everybody. As Sarah has said, we are aligned to regions, so we're a team of 3, and we're aligned to South West Wales, which Sarah covers, and South East Wales, which our colleague Claire is aligned to, and I am the regional lead for North and Mid Wales. So again, when you look at that, it shows you the health board footprints that we're aligned to, as well as local authorities. So you can see sort of for South West Wales and South East Wales, there is some overlap with Sarah and Claire. And again, covering Powys, again, we do share some of those areas, although I come down as far as Breda, and I hope I pronounced that correctly. So those are the areas that we're aligned to. And of course, we also work with our university colleagues throughout Wales and align students to placements where we can, as shared placements. When we were looking at the chef programme, our objectives, we were looking at to scope the care home sector placement, which Sarah has mentioned, to look to see how they can support healthcare students. And as she said, initially we were looking at undergraduate pre-registration nursing students from all 4 fields of nursing, but we also are looking at how we can also help allied healthcare professional students who will look to have a placement within a care home sector sort of going forward. And I, for example, have been able to align speech and language therapy students to care homes for a preclinical placement. So working with allied healthcare professionals in one of the universities, moving that forward. And again, other allied healthcare professionals have expressed an interest, occupational therapists, physiotherapists, dietitians, pharmacists, to have placements within the care home sectors as their programme progresses. Again, it's Again, a key point is to develop relationships with the care home sector, with the care home managers and their teams, and these have to be sustainable relationships that we build, and again, sort of with colleagues within HEIs and the social care and healthcare sectors to increase placement capacity for students. Again, I've alluded to the fact that we are looking for interprofessional placements, because one of the key drivers for HEIW is looking at how students can have interprofessional shared placements, because as Amanda was saying earlier, you know, the students working with medical students when they're coming into HEIs, but again, looking at this when students are actually out in placements. So we will be looking at developing those placements with students. So if you have an occupational therapist student who's in a placement and there's a nursing student, how can we bring them together? What are their roles? What is the common goals that they're working towards? And a key point for us as well is actually signposting our colleagues within social care to educational pathways. So again, promoting routes into nursing for those care support staff who may want to become a nurse, for example. We can actually signpost them to pathways that they can, access, for example, a part-time route. There is the dispersed learning route, again in Powys and Cyhadledd, and also, distance learning. So again, if you're thinking about potential students of the future who are in rural locations, there are these options going forward. And again, promote showcase what our colleagues within social care actually do. We know they are autonomous practitioners, their decision making, their leadership, their clinical skills are excellent, and we want to showcase that and showcase to students there is a viable career pathway outside of the NHS within social care. Sarah has mentioned, when you look at student nurse training, for example, it is 50% theory and 50% practice, and that would be similar with other allied healthcare professional students. So when you look at pre-registration nursing students, 50% of their theory will be 3 or 4 modules per year, and that equates to sort of 9 to 12 modules per their programme. And then when you're looking at their practice clinical placements, they can have 3 to 4 clinical placements a year. So again, that equates to 9 to 12 placements over their 3-year programme. And as Sarah has said, the majority of those placements are within the NHS settings. So again, it's about trying to show students that nursing care happens outside of the NHS. There is different environments that nursing happens. When we're looking at the governance process, we are looking to ensure the quality of practice learning environments. So we have a framework that we have. So, we have our links with Care Inspectorate Wales, Social Care Wales. We work with colleagues within the Health Board and also colleagues within the local authorities. And we are working with that responsible individual who is aligned to the care homes. And also Sarah has mentioned the national chef steering group that we have set up. So we have that process in place so that we are linking with everybody and then we're not working in isolation. And again, if we can increase the quantity of practice learning environments, and the diagram there on the left, on the right, is, students have exposure to care homes. They will be able to develop different skills and knowledge, and also that key point of showcasing a viable career pathway at the point of registration. And we are seeing that newly qualified student nurses are now opting to take up positions within the care home sector once they qualify. The numbers are small, but hopefully, fingers crossed, we will see those numbers increase. What? Sorry, just going to say a couple more. Another 2. Sorry. Thanks. Okay, what we've actually done is we've developed a stepped approach to how we will create a placement for a student within a care home. And the first step really is around looking at the governance, making sure everything is in place for a student to have a good practice learning environment. And then we'll arrange a care home visit. When we meet with the care home, the manager, the team, will have a look around the home, and more often than not, they'll always give us some nice tea and cakes and things like that. And if you're lucky like Sarah, she gets some on a tray with doilies and everything like that. And we discuss what it means, what's required to become a practice learning environment, because there is a lot of input that we have to give. So we do discuss that with them, and we do advocate they speak to their teams, and more importantly, they speak to the residents and the family members, because at the end of the day, it's their home, and the care home staff work around the residents, not the other way around. So it's important that they actually, get that approval as well from the residents and the family. And then we sort of start sharing key documents. And in Wales, we have all Wales documentation for student nurses that have been developed in response to the changes that the Nursing Midwifery Council brought in 2018. So if you're a student in South Wales and you come up to North Wales, the documentation is exactly the same. Again, once that's all been agreed and the staff are happy to take students, we will arrange to go into the home to start doing training, the practice supervisor, practice assessor roles, which are very new, although people still mention mentors and sign-off mentors. We moved away to practice supervisor, practice assessors, and myself, Sarah and Claire will actually go into the homes, and we do that in person because we feel it is important to maintain that connection with the home. And then we will sort of start sharing other documents like the local level agreement, which every clinical placement has to have. Once we have done all of the training and, you know, everybody is happy with that, we will then look at completing an educational audit. This isn't unique to care homes. Again, it's something that all clinical placement, whether it's NHS or social care, have to have in place. And what we do is we look for shared placement. And by that, I mean, if there's 2 or 3 universities that could potentially use that care home as a placement learning opportunity, we will do the audit together. We will invite those universities to join the home via Teams or come in person to complete that audit together, so everybody knows, and it's a shared document. And once we again have done that, we ensure that the local level agreement is signed by all parties that will be using the placement as well as the placement provider. And then when we have done that, students will then be allocated to that placement for their 6-7 week placement or 12-week, 10-week consolidation placement. And following the placement, all students, again, it's not unique to care homes, will evaluate their practice learning experience. And we will share that, we'll provide that feedback back to the placement provider, which we do anyway with NHS placements. Now, that whole process, from the governance process right the way through to allocating students, can take 4 to 6 months, because things are changing all the time within the care homes. You know, maybe staffing levels, maybe if they've had COVID, or there's different changes going in the care homes. It can take 4 to 6 months from that initial discussion right the way through. And I was quite surprised when I came, because I was the last chef to join the team in April, that it did take so long. But again, things just change all the time. So we have to be very flexible and adaptable around colleagues within our care homes. Thank you.
Okay. So far, when we've looked at that in terms of the setup of the main practice learning environments then for the care homes, they are areas that we would use as our hub placements. So the students would go there for their full placement. But what we're also looking at is setting up some of the other care homes in terms of residential areas, because there is an option for our students to work in a hub and spoke model. So with the residential homes, they would be attached perhaps to a community placement, so the community nurses, district nursing teams, acute response teams as their main hub placement, but then access one of the care homes within a residential care home for a week's learning opportunity within that. And it would be the home that's already linked with in terms of the district nurses going in and out of it. So it's not going to be an entity of its own. They're just going there for 1 week out of context for the rest of the placement. It's attached to where they're actually working and going in and out of with their practice supervisors and practice assessors. So there are a number of designated care homes that are already set up and established as residential spoke placements for our students. That's the type of elements that they're looking at there, looking at the legal frameworks, assess admissions, discharges, the support elements that are going into the residential homes. But it gives our students that good chance really to focus on the work that they've got going on, that they would have just perhaps seen snapshots of a person, seeing sort of them as a patient with a condition, whereas it gives them that opportunity to see what it's like for them living within that home environment in the residential setting, and then feedback across, and obviously completion of some of their practice assessment documentation, whether that's electronic or in paper format, because we've got the tool depending on the university. So that's just something additional that we are looking at to show that sort of all the different care homes have got something to offer in terms of learning opportunities for our students, whether it's sort of a main placement for a number of weeks or a shorter placement for up to that 1 week period. So there are options for both really in terms of the social care sector and what support they can provide really for our students within areas. And then it's just finishing off really after that slide then. So this is just some of the feedback and engagement that we've had to date really, because as part of the Bevan exemplar work, there's that requirement of saying sort of what's the feedback from stakeholders' involvement to date. So it did have to go quite wide in terms of the requests for this feedback. So it is from students, it's from members of the local health boards, it's from local authority set up, it's from professional leads. There's a variety of different people there, but you can see sort of all positive feedback. And I will say all of the responses that were had around the feedback have all been very positive. You know, there wasn't anything in terms of negativity. I know some people say, oh, we should have a balance, but the feedback is the feedback. You know, I can't show you something that I haven't got, you know. People are quite welcome to see all of the feedback responses, but I say they have all been positive to date in terms of that engagement level and the benefits that people can see, you know, from supporting students and how they can increase their workforce moving forward. So then we have just got there, our next steps really in terms of where we're at. And that word graph is just something that's come out of some of the feedback elements. You can see supporting the opportunities are there, ongoing support, care homes, you know, the home sector. These are things that people are mentioning regularly, but supporting obviously is our main element of it all. Challenging some of the misconceptions really about care home nursing, because sometimes it is seen as a different level possibly of nursing, or sometimes people go into sort of nursing homes towards the end of their career. But that's something that we are prepared to challenge and to look at. You know, we have got some good examples of how people are actually going, like Bernie said earlier. We have had a number of requests really now coming in, small number of requests, but for the students to actually go on the management or the consolidation placement within one of the nursing homes or the care homes that have been set up. And we are seeing that a small number of them are actually going there at the point. So that we are challenging those misconceptions, but fostering an inclusive community vision, you know, to make sure that we all know what our main drivers are out there, you know, the healthier Wales, social care well-being. So that are elements that we are looking at, you know, to see how we can bring these elements together really in terms of people having a really good understanding and knowledge base of how the sectors can work together, you know, in terms of introducing it early on so people have got the exposure that they need in order to bring that on for those shared learning opportunities then and positive experiences. So, diolch yn fawr. Thank you all. That is all from us. We've got a couple of links there to some elements that we have been working on. And then we've got our contact details should anyone want it. I will be around all day as well. If anyone does want to sort of speak with me later on in the day, we will be around. Thank you.
Sorry, I'm a bit taller. So. We've got a couple of minutes if we wish to take questions from the floor. Or, yep. Do you want to shout it? And I'll promise.
So you mentioned great work, and so encouraging to see this work going on, and I think it's really fundamental to some of the challenges that we face in the ambulance service. You mentioned that social care has got some great skills and health skills that I think something like that, which I agree, very demanding area, physically and mentally. But given the fact that our ambulance service receives quite a lot of calls from nursing homes, care homes, constitutes a greater proportion of communities, I guess, for our ambulance service. And they cause people with conditions such as resolved diabetes, seizures, minor falls, minor injuries. Is there a role, do you have a role in kind of
exploring the potential expansion of practice for people within those care homes, to make it attractive for people to go into that very difficult environment that would be quite unfulfilling in the long term, I imagine.
Hi, thanks. The question was from the ambulance point of view, whether the training could encourage more people in care homes to prevent so many calls to the ambulance service. I do it briefly.
Yeah, and I think you are quite right. And sort of some of the elements of the work that we are looking at is also making sure that the staff that are supporting.
It's me.
All right, look. Okay. Some of the people that are being supported, obviously within those areas, what we are looking at is if there's the need for it, sort of additional training for the registered nursing workforce within the care homes, and that's something that we've had discussions back with Health Education Improvement Wales around, sort of the continued professional development opportunities for staff within those homes to perhaps be have additional skills, you know, or to work at the level perhaps that would decrease the amount of calls that do come out to those areas, you know. So that is something that we are looking at as well. Even though I say our focus is around the student work, we do sort of encourage the development of those staff within the areas to make sure they've got the most up-to-date knowledge as well, to be working with the students, as well as increasing their staffing numbers by working with elements like Amanda said there about some of the level 4 training, which is in effect the first year nurse training. So any staff that engage with us across the social care areas are able to access that as well. But it's definitely, we are looking at sort of post-registration offerings really for some of those nursing staff without in the care homes as well.
Could I just quickly add something to that I know from sort of engaging with some of the staff that in the care homes, they're very frustrated that they have the skills to be able to care for residents, to keep them within the home rather than sending them into hospital, but they are constrained sometimes by policies and procedures, but there is work going on to look at how that can change. So but
There was one more in, we'll take one more question and then we'll have to move on. I've got to crouch in order not to upset the camera.
Thanks, Chair. I noticed that your overall placement strategy in care homes encompasses residential nursing homes. And it's good that you are encompassing these homes because the care homes are struggling for staff and giving students the benefits of what happens there will encourage in the future more placements and more care home staff. But does it also encompass the NI nursing?
Yeah, in terms of the question coming in then, it was about some of the residential homes and are we encompassing sort of EMI or some more mental health conditions in terms of the area? Yes, it does. So any care home we would see as a viable option for staff, for our students to actually go into and learn. We are working as well, I say, to place a number of mental health students, which obviously that's one of the key areas, you know, to be focusing on. So yeah, we are looking at all avenues in terms of the residential care as well as in across all 4 fields. So from the children's residential homes, across the adult areas, mental health and learning disabilities. So it's a wide encompassment we're looking at. Thank you.
Thanks very much. We'll have to wind this up now, I'm afraid, or I'll be in trouble for running late, having been in trouble for running early. So thanks very much, Sarah and Bernadette. And just a quick word from me that if, from my experience of over 20 odd years working in the care sector, getting something done in 4 to 6 months is pretty quick, if you ask me, not surprisingly slow. Thank you very much, both. And thank you for offering to hang around all day. So I expect people will be grabbing you during the lunch break. Thank you. Thanks very much. Touch the camera. Great, thank you. Now we're supposed to be having a a choice of breakout sessions now, but unfortunately, the breakout session in the Montgomery Pavilion can't go ahead due to Katie not being able to make it today. So we all are staying here, and those online stay on this link. And we're going to hear now from Stephanie, who's doing a PhD on loneliness in rural areas. So over to Stephanie when Anna's got it sorted. Thank you. Yeah.
Thank you. Would Anna like me to share, or is Anna going to bring it up?
We're just getting the presentation up, Stephanie.
Thank you.
No, I can't hear anything either.
Hi, I'm not sure who's monitoring the chat, but nobody can hear you.
Sorry, apparently we're having some technical problems with this at the moment. Not sure what it is, but hopefully it'll be resolved in a minute.
I think there's an option to click the tab to share with audio, so hopefully that should help.
We're trying again now. But those online put in the chat if they can hear.
We can't see, let alone hear.
For those online, although we can hear it in the room.
Would you like me to share?
Yeah, could you do that?
Yeah, let's see if this works.
Thanks, Stephanie.
Hopefully it will.
Can you turn your microphone on, Steph? We still can't hear you.
Ah. Would it be easier if I just talk to my presentation quickly to catch up on time?
Could you do that, Stephanie?
I'm happy to. Yeah, that's fine.
Could you just
Sorry.
talk to your slides? Thank you.
I was hoping to record, so I didn't run over, but we're going to go over. So I'll give a brief talk now. Okay, bear with me. Can everyone hear me online and in the room? Someone put in the chat that they can hear me. Brilliant, thank you. Sorry about that, everyone. I'm Stephanie Jones. I'm currently studying my PhD at Aberystwyth University. The title of my PhD is exploring how living in rural areas contributes to feelings of loneliness for diverse and rural communities, and really what is the role of the community in addressing social inequality and working to reduce levels of loneliness and social isolation. There's a wealth of literature exploring loneliness in its widest context, and we know that it's a public health concern. And I'll come on to my second slide shortly, which shows the breakdown in Wales and what we know so far. Oh, it's disappeared. Bear with me. Can you see that? Sorry, I know it came off for me. Okay, hopefully you can see that from my end. Let me just check. Brilliant. Thank you, Rachel. Okay, so loneliness can be broken down into two categories, really. You have social loneliness and emotional loneliness, and people can experience both individually or together, and they both have very different meanings. In Wales, recent evidence shows that 1 in 6 people have reported experiences of feeling lonely, and there are various contributing factors to that. The Wellbeing of Future Generations Wales Act monitor the progress of interventions for loneliness, and that is working to improve social, economic and environmental outcomes. And what we also know is a high proportion of individuals live in rural areas of Wales, and obviously they may be at risk of experiencing social isolation, which we know can also lead to loneliness. So Welsh Government did a survey of the Welsh population and found that there are various factors that can contribute to an individual experiencing loneliness, and you can see some of them here, such as age, gender, Welsh language, long-term illness or disability, and some of these may not surprise many of you. What did come out, which was interesting in the findings of this, was younger groups, and actually I'll come on to my research shortly, but similar demographics when applied to a rural context, and that's exactly what my research is hoping to do, is to really explore what does that loneliness look like in a rural context for rural communities, and how can communities be supported to develop effective initiatives which can work to tackle loneliness and consider that rural context and those rural factors. So my PhD research is broken down into 4 questions, and There are various phases of this research, and the element I'm going to present to you today is phase 1, and that is very much looking at and identifying who are the rural populations known to be at risk of loneliness in Wales. How do rural residents experience loneliness? And that really, a bit of that was captured in this, but it also comes into the next phase that I'll be moving into. How do existing examples of community initiatives contribute to overcoming rural loneliness? And a lot of that was picked up through my initial phase 1 study. And how can communities be supported to develop initiatives that will help to overcome loneliness for diverse and rural communities? So I've recently undertaken semi-structured interviews with 9 organisations in Wales. There were 13 participants, all belonging to those 9 organisations. All of the organisations met the criteria for supporting individuals who experience loneliness and reside in a rural area of Wales. And interviews are undertaken with a mixture of charities, non-government organisations, commission providers, and even small businesses providing community initiatives. So the aim of this phase 1 study was to identify through the stakeholders who are the populations that live in rural Wales who report loneliness, and who are the populations who are perceived by stakeholders to experience loneliness but not necessarily report that. What are the factors contributing to that loneliness for rural communities, and a scoping of initiatives and support that is available within our rural areas of Wales. So initial findings, and when asked, almost all the stakeholders, when asked what populations experience loneliness, you can see here I've included some direct quotes, because most people said everyone. Where do you stop? I think that's a better question, you know, and there was a real recognition that anyone could be susceptible to loneliness. However, this pie chart here, when I did the data analysis, certain communities really stood out as being frequently mentioned by various organisations, and there were those belonging to the agricultural community, those with chronic health conditions. Children, young people came out quite strongly. Even if organisations weren't directly working with children and young people, they were picking that up through the populations, maybe parents that they were supporting. Those with substance misuse needs, elderly, those with mental health, and the list went on. I think there were 19 categories in total, which really did show the breadth of populations named by the various organisations. Now, interestingly, what stakeholders told me is that people aren't readily coming forward or recognising that they are experiencing loneliness. They may say they feel alone, or they feel physically isolated or socially isolated, but they're not actually recognising that as or using the term loneliness. So when asked what factors are contributing towards loneliness, again, the list was really vast, and some of the key themes that came out were domestic abuse, and you can see here that identity, cultural challenges, disability, caring responsibilities, frailty, transport. The list really was endless. So I'm just going to talk to a few of these today for you. So language came out really strongly, and I think a lot of the provision in Wales and the fact that they do provide their provision in Welsh really came through as what mattered to the stakeholders and what mattered to the populations they were supporting. And I've included a quote here from one of the stakeholders that really highlighted that by saying, if you're in a crisis, you can't be in a crisis in your second language. And I felt that could be applied to lots of populations. So there was a recognition that where there were individuals who spoke a different language, it tended to be either Welsh, English, those are the most common. However, those individuals who spoke another language that wasn't English or Welsh, they really did feel like a minority, because they may be part of a very small community who could speak that language, and services felt very ill-equipped to support those individuals and have the services and support to be able to support them in telling their stories or sharing their experiences of whether it be loneliness or wider needs. Bereavement came up as a really key factor as well, and particularly following on from the COVID-19 pandemic, that a lot of individuals felt that they didn't get to hear the stories of their loved ones or share the stories of their loved ones, and the grief that caused, not being able to tell those stories. And bereavement was coming up by multiple organisations, and these organisations weren't just directly providing support for loneliness. They may come across it, but these individuals were coming forward. But bereavement was also something that was being picked up that had led to other, they may have, you know, contacted because of debt, for example, but then bereavement will come out as a key theme from that. So I felt that was really important to mention. And cultural needs, and that goes really wide, but again, where if we're looking at minority groups, for example, and we know that predominantly we are a white Welsh, white English population in Wales. However, it really came through by the stakeholders that when they did come across someone that was not white British, then those individuals really did feel like a minority, and they felt really quite lonely because of that. So there were some lovely stories that came through from the stakeholders where individual organisations had brought people from all sorts of cultural backgrounds together, and one particular where individuals who were from diverse backgrounds but all belonging to or identifying as an ethnic minority group were brought together. And you can see here, but in doing so they could relate on the fact that they were an ethnic minority and that they were experiencing some of the same challenges. And a lovely quote that came out through the interviews was, "I'm not the only one. That's an only one of one nationality. We're alone together." And I thought that was really special. So also community groups that have been set up. There's a community choir, for example, and it really came out that you know, that community intervention was bringing together lots of people from lots of different backgrounds with very different experiences and experiencing their own levels of loneliness, but that choir enabled everyone to have a voice. And you can see there they all sing together, and each voice is really important to what we do, and that was really important. But also what came through is a lack of resources reported by the stakeholder groups in order to support their service users' cultural requirements and needs in rural areas of Wales, particularly in those rural villages and pockets. When asked what provision and support is being provided in our rural areas, I was really blown away by the vast amount of support that is out there. Advice services, outreach support, community level groups, organised trips, events, befriending services for adults over 50, services going out to schools, really reaching out to those communities where they can, and a big shift to moving to remote online and digital activities, which we'll talk to shortly, as that comes with some problems. So there really is an amazing support network out there, and services are going above and beyond to deliver beyond their remit, I would say, in some examples. However, what I was hearing from the stakeholder groups is that whilst there's all these services available, often individuals who may be experiencing loneliness find it difficult to take that first step and engage in those activities or those support networks. And services are reporting a lot of hand-holding is needed to enable individuals to make that first step and get them through the door. In terms of rural specific challenges, I don't think this is surprising, and we heard earlier from around the presentation, the triple threat. You know, rural challenges are individuals who are experiencing these really are feeling isolated, and that really came through from the stakeholder groups. So transport, internet connectivity issues, access to health services came through really strongly from the stakeholders, and a lot of these stakeholders are really trying their best to support families and communities in Wales in overcoming some of these challenges. And you can see here one service reported that, you know, a family facing a very difficult decision of leaving their home because to live near a hospital because they have a chronically ill child, and if they can't get that support, that's a real life, you know, situation for them, and reality that they may have to move from their home. So that was really quite sad. And in terms of transport, multiple organisations are reporting the difficulties that even if there are services available, they can't get there. Limited buses, oversubscribed, mobility and frailty coming into that, relying closely on family and friends, and also with the cost of living going up. And I think I fear that's going to get a lot worse as we go into the next year. Digital access. So there was a real recognition from the stakeholders that the move to digital is positive, and that services are really trying to provide those digital solutions for rural communities. And when it works well, it is brilliant. But there are a lot of populations who don't feel able to access that online provision, and whether that be due to connectivity or whether that due to skills or confidence levels to access digital. So that is something that came through. So I've put here some key highlights, and we can see loneliness is experienced by multiple groups and populations. It wasn't restricted by age or gender particularly, it was very equal split and across lots of ages and lots of groups, that populations don't always recognise or report that they are lonely. And there was a real theme that came through around identity and the need for people to identify with someone and how that can support in reducing that loneliness. Rural factors, increasing the risk of social isolation and loneliness came through quite strongly, and the opportunities for social interaction had decreased since the pandemic. And where those opportunities do exist, there are barriers to accessing those, whether that be digital or the themes we've already discussed. Now, one thing that did come through was that whilst a lot of community organisations who dealt with a range of issues were seeing multiple communities, there was a feeling that they really wanted to engage with the agricultural community and recognised a need there. And those specialist organisations or charities that work to support those agricultural groups are seeing really high levels of need. So when I looked at the findings and analysed those, what came through to me was that there is an absolute acknowledgement by all organisations of the need to connect with the agricultural community, but actually the individual groups that are set up for those agricultural communities are dealing with needs beyond their remit, and that those agricultural communities are not accessing low-level provision. So for agricultural communities, I think this is going to be a key group that as I move into my next phase, and you can see here I've just talked to this, and we know that there are high rates of suicide for this population, and most organisations that I interviewed did report them as a hard to reach group. And you can see here some of the comments that organisations are recognising there is a need to break into that community. They're aware of the difficulties faced by farmers, but how they do that is still fairly abstract to them, or they don't feel that they are engaging with those groups. And just to really highlight that, I think it's quite a important quote here, that it's a combination of physical time, opportunity and technology all compounded on the same group of people. I would go into this in more depth, but I know we've run over time, so I'm just going to finish here on a case study from a group that is set up by farmers for farmers, and they described a situation where a lady has been calling them for 5 years. They don't know her name, they don't know where she farms, she won't tell them, but she phones their helpline regularly, and during the call suicide is a topic, but she always ends the call with saying speak again soon, which lets them know she'll be alive. They don't particularly deal with any issue, she just phones and has a good moan, and that tells the person on the other end of the phone that there's nobody else that she can have that moan to. She can't go lean on the gate, she can't go and have a moan to her neighbour, she can't speak to anybody in her family and moan to them. She phones the service, and they do feel that she regards them as friends, and they said that reported that that's just one type of person who may repeatedly phone their helpline to offload and to have a chat and a moan, and sometimes it is just as simple as having someone to talk to for these individuals. So I will leave it there, and thank you very much, and I'm so sorry for the issues around connecting.
Thanks very much, Stephanie, and sorry about the technical problems at the beginning. We've got time for a quick question, but I don't eat into people's lunch break too much or I shall be in big trouble. There's a question at the back there, Anna, if you can get there.
It's a great study, a really important study as well. It struck me that your general findings can be applied to any population group, not just those labelled lonely. And quite rightly, you highlighted the role of communities and community groups in addressing this issue. What sort of recommendations are you making for organisations and for government to actually value the contribution that communities can make to this important valuable problem or issue?
Thanks very much. I don't know if you could hear Stephanie or online, but the question was about what sort of recommendations would you anticipate making to support community groups to support people who are affected by loneliness?
Yeah, absolutely. And I think that will be the sort of final stop really of this PhD. The next phase will be going on to interview most likely the agricultural community, because we recognise that all of those factors, the agricultural community or those belonging to the agricultural sphere, would not be exempt from experiencing those factors. So I think once we've got the findings from phase 2 and we've got that really rich understanding, also combined with some case studies I'm going to be combining around community initiatives that are available. And once we triangulate all of those findings, those key recommendations will be able to come through the voice of the individual populations, the stakeholders, and some really good examples of what's going on. So I don't have the answer for you today, but hopefully over the course of the next couple of years, I will formulate those recommendations and work with Rural Health and Care Wales and Aberystwyth University to really put a highlight on those and hopefully come back and present some more findings.
Yeah, that would be great to hear the outcome of your research, Stephanie, at some future date.
Thank you.
Thanks very much. I'm going to thank you and wind up for lunch now, because otherwise, as I say, I'll be in trouble. And please, everybody, take time to look at the posters if you haven't, and we reconvene at 1:30. So thank you one and all. Enjoy your lunch breaks wherever you are.
answering machine. Please leave your message after the tone. Department. We have received 2 charges from your card this morning. The first charge is a £300 from Amazon, and the second charge is a £1,100 on an international money transfer website. We believe these to be suspicious as unauthorized transactions if you have never used these services in the past through your card. To allow these transactions, press 1 to cancel or speak to our support team, press 2. Thank you. Thank you for calling.
roed o USB yma, because maen nhw ar fan. O, hyn di bobl sy'n cefndir, ie. Dyma ni ar mute wan, fydda ni'n broadcastio'n sgwrs cyn iddyn nhw sylwad hen.